Good afternoon, everybody, and thank you, Dr. Archie. We look forward to hearing from you, Mayor Warren. We're all interested in this topic to see what we're doing with regard to some really important efforts. So, Mayor, you want to get us started?
Thank you, President Scott, and really want to thank City Council for your leadership and your support of the city and our residents during this trying time. It has definitely been some, difficult times for all of us here in our community. I want to thank Dr. Archie and the Real Rapid Response team for the work that they have been doing in partnership and in conjunction with the County of Monroe and the Department of Health in the state of New York around trying to make sure that our residents not only get the information that they need, but also get the testing that they need right in the community in which they live. So he's going to go over in detail a number of different initiatives, partnerships that we have been able to develop through the Real Rapid Response team that was born out of the Racial Equity and Leadership Committee. It's the subcommittee of that the city started a number of years ago to really make sure that we're responding to the needs of Black and Brown communities in real time. And so they've done some extraordinary work when it comes down to looking internally at what we're doing inside City Hall. But we are in a crisis outside in our communities, in our neighborhoods. And just this past weekend, last Friday, Thursday, actually, we got a call from one of our constituents who had been looking for support. Harbortown, residents had been experiencing some challenges. A number of residents had tested positive. They were scared. Their management was very scared, reached out to the county, reached out to the city Office of Constituent Services, was able to put them in touch with Dr. Archie. And immediately they hit the ground running and was able to, because of these partnerships, get the testing that these residents needed, was able to help the staff of Harbortown be able to make sure that they are sanitizing and doing what they need to do properly. And so this is really what it's truly about during these trying times. Earlier this week, we released Everybody Needs a Plan. COVID has hit, me, touched me very personally, not just with my uncle, but also with my mother. And so when you have to look at what happens when it hits your home, the likelihood of all of us in some capacity or a loved one or a friend being impacted by COVID, you want to make sure that they have the support, they have the information that they need, that they have a plan. Give an example, my aunt called me all the way from Atlanta, one of her friends that live here, family doesn't have any family here, was diagnosed, was having a really rough time by herself, needed some juice, needed to get some medicine from the CVS and didn't have a plan, right? Didn't have, so she called all the way to Atlanta to get my aunt to find somebody within her family to go and get her the juice to drop off at her doorstep. And so things that we don't really think about until it hits you skin to skin. And so we want to make sure that our residents are thinking about what happens if and when this hits your home. And so Dr. Archie has done a great job, and I'm going to turn it over to him to talk about our COVID outreach plans. I know the deputy mayor has been doing a lot with working with the Finger Lakes Regional Economic Development Council, or the Finger Lakes COVID response team, as well as the county executive's office, and making sure that we have information real time as well. And so after Dr. Archie talks about our outreach, we'll just talk about where we are now, where we believe that we will be. I do want to commend, I don't see him out here, but Vice President Lightfoot for the work that he's been doing on behalf of some of our most vulnerable businesses that are suffering when it comes down to our barbershops and beauty salons, when you look at it, that, this is, I went to college in New York City. So, it's one thing, there's a big difference between the Bronx, as in travel time between the Bronx and Brooklyn. So you shut down something in the Bronx and, most people are not going to travel all the way to Brooklyn. But here, when you can travel 10, 15 minutes to get to a barbershop or get to a restaurant, it's causing some major inequities. Our businesses are suffering. The people of our city are suffering. And we're going to try to do everything that we can. We appreciate all the things that you have done in allowing us to give out business loans, business grants to our residents and to our businesses, helping our tenants and all of that. But we know that every little bit helps, but it's still not enough to help with everyone that is suffering at this time. So Dr. Archie, if you want to kick it off, and then we'll turn it over to the Deputy Mayor.
Thank you. Thank you very much, Mayor. Good evening, Council. I am grateful to spend some time with you today to kind of highlight some of the efforts that we have initiated per the city in support of maintaining and protecting the citizens of Rochester, but also supporting some of the aligned needs of the residents of Monroe County as a whole. And so I'm going to be spending a little bit of time today talking about what we are working on now, how we got to this point to where we are, and then also highlighting some of our next steps coming up, so that I can highlight the sort of alignment or the time frame that we're working with to roll out this plan effectively. So BJ, I appreciate you providing me access to the screen. So I'll pull up, I guess maybe one or two documents to sort of highlight some of the work. So I'm certain each of you are aware or have seen this document that's up there, and it's just highlighting what our most recent testing sites and efforts are per the Real Rapid Response Team in partnership with the County of Monroe. We got to this point because the City of Rochester was engaged by the county after successfully implementing a rollout plan and engagement strategy for testing during the month of October, where we were within specific communities throughout Rochester, for faith-based communities that provided free testing and free flu vaccinations at that time for a matter of 12 days consecutively. In those 12 days, we were highly successful with both vaccinating for the flu as well as the actual COVID testing. I think our numbers almost topped 1,000 in a matter of 12 days. And so with this approach to be very intentional with pipelining these critical resources into these communities that are most vulnerable and disenfranchised, we were grateful and humbled to have the county come back and say, if we are going to succeed, then we're asking your support and your efforts to make this happen, because the structure that we developed, the framework, the partnerships that we had created, the organizations that we brought to the table collaboratively demonstrated an effective avenue for pulling this off in a very short time frame, but doing it very efficiently and effectively at the same time. And so with this effort, we utilized these testing sites, if you would, as an opportunity for us to really have a framework of what we would do for this upcoming testing opportunity. And so just recently, I just pulled up the testing sites, and I can pull that up again because I want to make sure that we walk through each of the sites so that you know what dates, where we are, the locations, and the timeframes for each. So referencing this timeframe, referencing this list, and I hope you all can see it, referencing that list of sites and dates, what it provides us with, BJ, is it on the screen or no, it's not on the screen? Okay, let's see, let me share it. All right, how about now? Okay, so with the 4 testing sites, we wanted to partner with the, because all of this was developed out of partnerships, all of this work collectively. The testing sites, the testing schedules, the dates, the locations, et cetera, were established in partnership with the Rochester City School District, working with their leadership. I think his name is Mike Schmidt, who is the Chief Operations Officer there with the city, who helped us to identify the 4 different schools in the 4 different quadrants of the area. And this was intentional to make sure that we were providing access to the 4 different major parts of the city where people did not have to drive farther or extended periods of time or try to gain transportation that may not have been as accessible. And so these 4 sites have been selected, and that's East High, Benjamin Franklin High, Wilson Magnet High, and Jefferson High. And out of the 7 days a week, 4 days we are offering testing. What's critical to these options, these opportunities, is that accessibility, as we spoke about. So these services are being provided 100% free to any and all persons needing these resources and services. There will be no cost at all. In addition to the actual testing being provided for free, we are working and have come to a partnership agreement with RTS, which as of this Saturday, RTS will be providing transportation. They will be creating these specific routes that are within a 3 to 5 mile radius of the testing sites per quadrant. And with over that 3-hour time frame that we're offering the testing, they will be cycling the sites back and forth, dropping people off and picking people up, making sure that we are providing our access to the city of Rochester's residents. This is critical as we understand that there are additional barriers that are within the city that may not be reflected outside of the city. So the additional higher levels of poverty, the additional limited access and certain resources that our Rochester residents may have, as we have a larger deaf and hard of hearing community, et cetera. And so we must do our part to make sure that all of the testing options that we are providing are accessible to the people that need them most. And recognizing the sensitive needs that the city of Rochester has, we must be deliberate in our efforts to do so. DES and Commissioner Jones and Karen St. Aubin have been very critical in making this happen. They have provided many of the supports, many of the resources and the supplies that we have needed in order to pull a lot of this off. The school districts themselves, each of the schools have been very complimentary in making this happen, partnering with the county, with the Real Rapid Response Team, the Rochester Police Department, who is helping us to facilitate the monitoring of the traffic flow, et cetera, to really make sure that these processes are as seamless as possible, as an opportunity to make sure that we talked about accessibility. So we're working with URMC to look at translation services, because what we do know is that there are so many varying needs, not just of persons of specific languages, but also persons of specific abilities and or disabilities. And so that's critical to make sure that we are providing persons that have these resources. There are family members who have come. I remember at East this past Saturday, we had a family. Well, the entire family was the members of the deaf and hard of hearing community, from the ages of under 10 all the way up to the mother and father. And so making sure that when these people arrive for the exact same services as others, we are there to meet their needs. And so it's just humbling to know that we have so many volunteers and staff and partnerships that can help us to produce some of this. So this is the scheduling for where we will be for at least the remainder of this year up until the January 1 timeframe. And the reason why I say January 1 timeframe is because we are currently looking at additional options and opportunities to extend these services and resources through the new year, recognizing that COVID is not going away anytime soon, although we are aware of the access in the future to the vaccination, which ultimately for the general population will be multiple months off. And so what we want to do is to make sure that we are sustainably putting in processes that could help to protect us in critical ways going forward. And so these are, I want to make sure that we talk about even more accessibility things before we move on, is that every one of the sites are ADA compliant, making sure that there are ramps for people who need access physically to locations. We are making sure that every one of our 4 testing sites within the city are both drive up and walk up. And that's important because we talked about citizens who may not have cars and vehicles and transportation. And so with the bus lines and additional resources that we are providing, we want to create the environment and the atmosphere that if you are finding access to get here, we will treat you when you are here. And that's very important, as we stated again, recognizing the distinction between the city and the towns. The surrounding towns do not allow for walk-up options. If you are not pre-registered and do not have a scheduled time frame for a test, as of this point, they are not permitting people to be seen. The city is different, and we are being very intentional with saying, if you are provided access to get here, with whether it's on the bus or it's one of the resources that we are providing, which are free, we will see you based off of our availability and times that you arrive. And so that access point is critical for people to take advantage of.
Dr. Archie, has any thought been given to mobility, just in terms of going to where the people are, as opposed to, or in addition to the people coming to where you are? The thing at the Harbor Townhomes in Charlotte is a perfect example, where there is, I think there's like 500 residents there. And who knows how many of them have any form of transportation and might not be able to do the bus trip or whatever. So is there any thinking, whether city or county, about having some of those kinds of mobile sites?
Yes, Madam President, just to jump in really quickly, the county executive and I had a conversation just last week, a discussion about, some of the senior facilities and making sure that they get access to testing on site. And I believe that, Dr. Archie, I think that the rapid response team has been talking to RHA and some other senior facilities about doing that, with what we have going on here with these testing. One of the biggest issues is having the staff and having the volunteers to be able to do it. And so they are hiring more people, but that is one of the challenges in doing those sites, those on-sites.
Absolutely, Mayor. And then to follow up on that, so per the real rapid response team structure, Madam President, that is the focus of this group. So just like we did with the church initiative, we didn't have people come to us, we went to them. And so as a part of this very same structure and this opportunity that we're looking at with the real initiative, so in general, we are providing these larger testing operations in partnership with the county. We are also, as we did at Charlotte, as we did at the Harbor Town Homes for the elderly community, we are specifically creating these smaller, as our resources will allow us to do, and as our manpower provides us, we are looking at how are we looking at more intentional ways of meeting people where they are. So as an example of that, with the example that you gave, so obviously we are all aware that the city does not own or has any governance over the Department of Health. We don't have any of those facilities. Those are not services we as a city provide. However, when we did receive the phone call last Thursday that the Harbor Town Homes elderly community was in dire need due to high volumes of numbers of people being diagnosed. And literally from, I think, speaking with personnel over in ECD, there were 34 calls for emergency response to that community within a matter of 10 days. Although we ourselves independently don't possess the resources or the structures to do so, our partnerships such as Common Ground, our partnerships such as Jordan Health, who are specific agencies that have a very good community-based approach in providing these resources. So immediately I reached out to both of them, both of these entities, and between us and both the Jordan Health as well as Common Ground, the Black Physicians Network, the Citizens Fighting COVID organizations, we collaboratively came together, and within 2 hours of me getting that call, DES had delivered over 500 masks, 500 things of sanitizer, 500, et cetera, to make sure that we were doing what we could immediately to stop the spread. Additionally, within 48 hours, there were a total of 250 emergency tests conducted where I myself, Dr. Candace Lucas with the county, Dr. Linda Clark, Jason Dunn of Jordan Health physically went down with our staffs in that building and went floor to floor, door to door, having the property management team each bring them downstairs, testing every last one of them. And so in addition to these larger testing efforts where we're setting up the sites, if we have the access and the resources and the partnerships to do so, we are responding accordingly, because obviously we align with your expectations of saying, what are we doing to meet our people where they are? And so this is to have that multi-pronged approach. And with the mayor's blessing, which she immediately gave when I called and spoke to her about the Harbor Town, she said, we have to move quickly. And so doing so, we were able to operationalize these different entities to make that happen very quickly. So in addition to that, just to give you some—
Dr. Arch.
Go ahead.
I was just going to ask. First of all, I want to say thank you. I was actually sorry I can't be on video. I actually went down to Edgerton today and got a test. Saw Dr. Archie and Dr. Lucas from the county there helping to administer the test. It was really an amazing scene. I guess my real questions are about the number of tests. Like, do we have a finite amount of tests available? And also, I think it's important, like I've taken a lot of tests. This one is the self-administered versus being administered by a healthcare professional. I'm wondering if there's differences in that good or effective the results are. Is there any discrepancy between those types of tests?
So I'll start with the first. So the number of tests. So initially we received 4,100 tests from the county, who ultimately received their test from the state. And these rapid tests were distributed equitably amongst the 4 sites. And so as of this past Saturday at East, we did we did close to 500 of those 4,100. Sunday, as stated, and Monday, myself and Dr. Lucas and Jordan Health and Dr. Clark's team did an additional 250. On Monday by itself, when we were out at, what was that, Ben Franklin, we did over another 500. Wilson yesterday and today, there were at least 300 respectively. So what we do know is that people are showing up and rapidly responding to these tests. And so we have already submitted officially a second request for more tests. I was notified that as of this past Monday, Monroe County did receive additional tests from the state. And so this is where it comes into critical nature that we consistently monitor and inventory how many tests we have. And so we are regularly engaging and requesting more tests that are provided via the county, but comes directly from the state. And so this is where our goal is to at least have enough for 2 weeks at every site in advance, so that we are not remaining low and not able to meet the demand that is clearly very high. After this Saturday will be 1 week, and we are more than multiple thousand into already. And that 4,000 that we got was initially supposed to last us through the month. It won't last us 2 weeks.
It's a wonderful thing that so many people are getting tested.
Mm-hmm.
It sure is. I have a question about that. You know, if you go online right now, you can't pre-register because the rest of the month is filled up. For someone that wants to get tested right now, can they just, even though they're not pre-registered, still go to one of these sites and get tested?
Although we are highly recommending that people do, if they're able to, what we do have is 2 options. Is that first off, what we are aware is that some people are registering, but some people aren't showing up. And so this is why we're not telling people don't show up, because if there's a spot where someone didn't show up, we don't want to deter an opportunity for someone who could have received the test for someone who did not show up. Okay, additionally, even if the list is full and you can't register as stated, there is always the option to do a walk-up test. Okay. Obviously, that will depend on how long your wait will be, because obviously that process is a little bit longer. Council person, because you have to register and get all the information. So what I can say is it's not this 2 hours long. It may take an additional 10 minutes, but you can still walk up, although it may be a delayed process to do so.
Okay, thank you.
Mm-hmm.
And this is for asymptomatic folks, right? So if you are symptomatic, what does that process look like?
So one of the things that we're not doing is that we're trying not to turn anyone away. So whether you're symptomatic or asymptomatic, we are treating every person as if they are positive. And that's because we need to make sure we are protecting ourselves. Everyone is wearing PPE, so that even if you are negative, we are handling everything with over precautionary to keep the exposure and the spread down. So there are people who have come in that some of these people, although in smaller numbers, are symptomatic. Literally per the registration form, it actually asks that question and it lists the different symptoms to let us know more cautiously so that we can be prepared when we engage with you for the test. This kind of goes back to Mitch's question, which is having people self-administer the test. So what we've done is we have a required training that the facilitators or the clinicians have to go through, that when you come in for the process, we actually hand you the swab and we walk you through the process of how to effectively administer it to self. so that literally still keeping that exposure down to the must and to the best of our ability. But in relation to Mitch, you talking about the reliability of the test in comparison to the more extensive or the comprehensive test that takes 3 to 4 days, what Dr. Mendoza's team has stated is based off of the cost, based off of the data that's been provided. These tests, although clearly are different and may not be as 100% reliable as their counterparts, are efficient with the same malign data that we are using to get the outcomes that we are needing. And so they are pretty rapid. And so far we've had pretty much success in our ability to sort of measure them in consistency with other structures of testing.
Yeah, this is just incredible. The only other thing I'll add is, calling around, trying to get some people tested was my morning today, and going through the hotlines. I don't think they have the information that you can walk up because they say that you need an appointment, and then appointments aren't available until, weeks away. So that may just be some information that they don't have about what we're doing.
So this afternoon, about 3 o'clock, I had a conversation with 311 personnel, and we relayed that information explicitly. Now, again, I really want to encourage everyone to either do their best to call to register or to register online, because that literally allows us to have a scope of what we're working with and how much staff we are needing. So that, again, our purpose is not to have people, we would prefer that if everyone had the resources and the access to drive through, so that you wouldn't have to get out of the car, you wouldn't have to be around other people, etc. But as that's not an option, we are obviously going to make sure that we offer people the second opportunity to get tested, which is the walk-in. But we are strongly encouraging people, to the best of your ability, who have that access, to register. But if you can't, because we understand there are only so many slots, it is okay to walk in.
Thank you.
Dr. Archie?
Go ahead.
Sorry, I'm going to keep with the
You're
questions.
fine.
I just wanted to give a huge shout out. Great job. Thank you so much, Mayor, as well, for stepping up with the needs of the community and the high rises for people who just can't make it to there. And I really appreciate it. Thank you so very much.
Thank you. It's our privilege.
I have a question. This is excellent work. I'm very happy that there's a testing site right up the street from my house. I plan to go up there and get a test. I do have a question, because there have been some inquiries about, will there be additional opportunities for people to get PPE from the city at some of these sites, or maybe at a different time?
Okay, so you cut out on me a little bit. Can you repeat that once more? I'm sorry, Councilperson.
Okay. Is there going to be an opportunity for residents to get PPE supplies at these sites, or at a different time?
What I do know is that PPE is available, whether it is at the site or their actual, the Monroe County has an online website that they can actually request PPE be sent to them. But if there are any emergency needs for PPE, the city has been responding accordingly. Like, one of the first things that happened with the Charlotte community, as I stated, is that when we spoke to them on that Thursday night, DES delivered them 500 of everything within a matter of hours. And so we've been communicating that to make sure that as people are needing it, we don't want you to go without because you lack the resources that we can provide. So if there are any requests for additional PPE that are being made at the site, although our purpose is to try to keep things flowing and keep the exposure down as much as possible, if there is a request for some, we are providing it on site.
And we also are giving out PPE at our dry sites where we're handing out food. So if people are looking for masks, they can go there. We have been talking with our commissioner of DES about possibly doing another, mask and hand sanitizer giveaway. We just haven't finalized that yet, because of some of the issues that have already been raised with people that can't get out of the house. The last time we, as a city, decided to mail masks to every household. So, those are options that, dependent, because we can get, reimbursed for those costs. So those are things that we're talking about now.
Thank you.
No problem. What's also important to consider is that right now I'm moving into that next phase of sustainability. So this week we've sort of benchmarked what it takes to make this happen, the number of people, the strategies, the protocols, who we need at the table, et cetera. But are these initiatives that we are implementing now, which are emergency, sustainable? And so this is what we're looking at now to say, so what would it take to have these facilities sustainable, considering that schools will be opening in the spring semester? What are the resources? What additional lift will DES have in attempting to set up these structures, not only for the next month, but for possibly the next 3-4 months? And so what will those costs look like? And how are we really looking at that in a sustainable way to really be able to drive some of this stuff going forward? So this is where, the sustainability will help us to really sort of manage this disease, because testing is only a part of it. And to sort of maneuver into that next part of this brief presentation that the mayor spoke about, is that testing only makes us aware of what we are. Testing does not give us the opportunity and the guidance and the model to say, what will we do, which is to help us to manage through the impact of what the testing result gives us. And so working with the Real Rapid Response Team as well, there is this Real Rapid Response Team COVID-19 Preparedness Plan that we have created, which specifically asks the community to start thinking about in advance, not waiting until you go in to get a COVID test to see what you will do and what your needs will be, but specifically looking at those critical essential areas of what you need to have in place even before. Prevention is always better than response. So how are we looking at what are we doing now to both prevent as well as to maintain and be self-sufficient and protect our livelihoods while we are enduring the possible exposure to COVID-19. And so with this COVID-19 preparedness plan, it's sort of a guideline, if you would, that asks for every City of Rochester resident to think about what are those critical things you are going to need to be sustainable if COVID-19 comes and knocks at your door. And so what we've done is created this sort of document that can be both printed and hard copy, which as of this point, we printed over 10,000 copies and immediately started distribution, as well as created this online accessible document as well, because we want you to be able to distribute this plan to the people who you will need to help support your plan. And so looking at this, it starts off by just asking about basic prevention efforts that we ask each family and each person to have regarding PPE and sanitizer, and wanting them to specifically fill out what they have in place for around prevention. Do you have reusable masks? Do you have enough PPE? Do you have enough linens and personal clothing? And how are you cleaning them? Are you washing them with soapy water? Do you have enough food, non-perishable items? So if a person gets sick, and if a person who is a parent has multiple dependents, and they themselves, whether their dependents are their children or whether the dependents are their loved ones or an elderly family member, not only how will you take care of yourself, but how will you take care of those who are also dependent upon you? And so it asks us to think about these things in a sort of 10 to 21 day time span to say, what do you have in place to make sure that not only will you be safe, but also the people that you're connected with? And ask about the quarantine isolation. So if you get it, what areas in the house are the quarantine sites? What if you live in a studio apartment where it's just all one room? So it may not be a room that you can have as a quarantine room, but a quarantine place that can be isolated by distance and social distancing, et cetera. Thinking of all of these things regarding our people who may not have multiple restrooms and multiple bedrooms. So what if everyone in the house has to share one bathroom? What are the protocols that you're going to put in place to make sure that everyone who's using that restroom is not exposed additionally to COVID? So it's all of these detailed things that we're asking every community member in Rochester to think about, to plan ahead, to identify what is going to be essential to what you need. Who are the specific people you are going to be depending on to help support your plan? So if you and your children are all in the home and you are isolated and your children are quarantined because they live in the same house, but they are also exposed to you, they themselves cannot go out in public. So how will you manage? Who will be those persons you depend on to take care of groceries and medications and et cetera? And so this plan is very comprehensive with making sure that we are looking at all of the critical things that it would take for us to be sustained, not only to COVID, but also through COVID. And so with this, there's an essential contact checklist for making sure those people have your alarm codes and insurance cards in case you are incapacitated or even worse, hospitalized and cannot respond accordingly. And so this document really allows us to think about this. And this last category asks about financial and economic resources. So if you can't work and if you have no income coming in and you can't leave the home, what's your plan to sustain financially for 2 weeks? Do you have a plan in place? Are you aware of the multiple resources that are available through both the state, the city, the county that provide these resources to you? And if you don't, what we've actually listed is additional checklist that gives you additional resources on where you can find out about more information that may be relevant to you. And so the plan is extremely important because what it does is it allows us to be preventative, because when we have a plan in place, we still reduce the spread and exposure. And so this is where the plan as well as the testing efforts go hand in hand, which will ultimately lead us to the vaccination distribution strategy, which will also be important. And so lastly, what we're doing as well as we've interacted with the county's Department of Health, the Real Rapid Response Team, to engage them about learning what is the actual vaccination distribution plan that they submitted to the state a month ago to confirm that the targets that we represent, which is those more vulnerable populations, will have immediate access to them equitably once the vaccine is within our community, and making sure that we're helping them to develop strategies to engage our communities who are already very skeptical about the vaccine in the beginning. And so this is where it's that total response that we're looking at the beginning and the end of how we're not only getting to testing, but through testing on through the vaccination.
Does anybody have any questions on the COVID response plan? As Dr. Archie indicated, we have printed out 10,000 copies. We're distributing those at every site for those people that come in and get tested. It is available also in Spanish as well. And we're distributing them at our food distribution sites. We're also emailing them out to all of our neighborhood associations and business associations, asking our employers to email them out to their employees as well, so that they can think about, their employees have their employees think about it. We emailed it out to all of our employees as well. And so we're trying to get this system in as many hands as possible so that people can think about it.
Just a comment. Madam Mayor, Dr. Archie, well done. Thank you. Outstanding presentation.
Thank you.
Thank you.
Thank you. And then to just finalize everything, the deputy mayor, just to cap on what's happening and what he's hearing from the Finger Lakes control room. I think that we all know that we are getting ready to face some trying times here. The numbers are going to continue, we believe, to go up. But we know that we are in control of our own destiny. We've been here before. We can overcome this. We've overcome it before. So we just need to make sure that we continue to protect our circle and ask everyone to take these matters as seriously as possible. But Deputy Mayor, if you want to talk about what you learned in the control room, that would be great.
Sure. And if I could, Mayor, before I do that, just to say, the ongoing effort of being plugged in with the county's regular briefings, as well as the control room and coordinating that, it is really, I think, been something that has been very fortunate for our community, and that so many folks are working together, and it has been very positive. Just to, if I could, talk a little bit about when the county initially came to us to take on the effort of testing that Dr. Archie just talked about. They came to us, Arundequoit, Greece, and Brighton, with no infrastructure, and said, we want to partner and we want to figure this out. I think with everything that Dr. Archie outlined, it's fantastic. We were able to pull that off using what we had in place with the Real Rapid Response Team to coordinate that. And I think that our success is going to be by continuing to do that. What we are learning on the calls that I take part in every few days through the control room, it's pretty daunting right now. Obviously, most of the call conversation has to do with the counties who are involved in the provision of public health on a daily basis. But to give you a sense of where we are, even though we keep hearing all these numbers, keep in mind our 7-day average right now is 578 new cases. Yesterday's positive cases was 607. If you look at those two numbers over the course of the past several weeks, it's always the yesterday's cases are always way beyond the average. It always continues to go up, and that continues. A week ago, our percentage of positive tests, I believe, was somewhere between 4 and 5%. It's now at 8.3%. So as a county, these numbers continue to go up. And what does that mean? So the governor's staff and the control room certainly don't want to, they want to take their direction from the governor. They want the governor to be the one to make these decisions. But it seems pretty clear that as a region, we are probably going to go completely orange, and that restrictions and changes will cover the entire Finger Lakes region fairly soon. We do have the highest hospitalization rate right now per capita in the state. And that is the metric that they're using to make decisions right now based on whether they add additional restrictions or closings, et cetera. I have heard, though, that because the data does not support the spread of the virus in barbershops, beauty salons, et cetera, that there may be some changes with that, and that those businesses may actually be reopening as soon as this week, with some guidance, of course, and with some additional regulation, but that they may very well be reopening. And additionally, I have heard that they may do restrictions on restaurants statewide, which would probably not alleviate some of the restrictions on our restaurants, but rather would have restaurants that currently are not being restricted in areas outside of the city. They would begin to have some similar restrictions. So it appears everything is tightening up. These numbers are getting worse, and we all do have a role, obviously. And until the vaccine can move ahead and we can achieve, a herd immunity, it's going to continue to be very difficult. I know Dr. Archie mentioned that we are always pressing the county and others to make sure that the unique needs of our city residents are met, and that folks who do have challenges and barriers to having access to testing or other things that they're able to overcome those, and that we're able to overcome those challenges and barriers for them. I want to tell you that Deputy Chief Everett, as well as Battalion Chief Luna, are working with the county now through a longstanding system known as the POD system that the federal government initiated some time ago, in order to push out medicines that might be needed, whether there was some type of a biological attack or an issue like this, where we have a pandemic. That system is in place, and the fire department has been a part of helping to organize that system, and they are now helping to implement it as it will be implemented, of course, in order to distribute the vaccine. So those conversations have more than begun. I know Chief Everett and Chief Luna are working on that within the fire department, because we do need to start thinking about how are we going to make sure, of course, that our citizens have access to this vaccine.
Just to quickly interrupt for a second, you remember a number of years ago when the flu was really, really bad, how the Blue Cross Arena was utilized and people stood in line to get the vaccine. That's what the deputy mayor is talking about, that we would have a community response in partnership with the health system as well as the county to make sure that the vaccine is given out appropriately and safely.
Yeah.
Just a couple of quick questions. Deputy Mayor, you had mentioned that we're looking at the entire region going orange, the entire Finger Lakes region going orange.
I confirm that, Councilman, but I was told that it looks likely.
Okay. So if the region is going orange, does that mean that the city or big chunks of the city will be going red? And if so, what businesses will be closed, or we're not doing red?
No, the only information I have is that because the rates are going up and hospitalizations are so high, that other areas would go orange just as we are, and that that way, I think we all know there's a discrepancy, right?
Mm-hmm.
Our roads in the city are closed, yet people can drive up the road to the Cheesecake Factory and go to dinner, and so that's a real burden for our local and small businesses here in the city. And it also doesn't make a lot of sense, right? You've got all these other places that are packed with people because there are fewer restaurants to go to and people are just driving the couple of minutes down the road. So I think the idea is that it is likely that there may be changes that would kind of standardize that throughout the region, but doesn't that happening going to orange doesn't mean that we would necessarily go to red.
Okay, so we're not potentially looking then at any further restrictions in the city of Rochester
Not that I'm
based
aware
upon
of.
what you're hearing. Okay, good.
Not that I'm aware of.
Question about the vaccines. I heard about our effort in terms of getting the community vaccinated, but one of the issues that keeps popping up is this sort of baked in wariness on the part of communities of color.
Sure.
What I'm getting is that wariness, it seems to be less so among older people who may have more knowledge or awareness, if certainly not necessarily experience, but awareness of the whole Tuskegee experiment thing. But somehow that's sort of in there. People who have this lack of trust, they're not even sure where it came from, but over time, I think that has fed it. But that I'm seeing is more prevalent among younger people.
Sure.
So will we be able to assist in being able to put forth some credible messengers, some folk that people would be more likely to listen to? Because I think older people or those of us who are more compromised you don't have to tell us twice, just tell me where it's at and I'm going to get it. But younger people, they're like, first of all, they've got this invulnerability thing. And secondly, they got this, I don't trust you. I don't know you. I heard some bad things about you.
Sure.
I think we've got some work to do if we're going to be able to move that.
Loretta, that's an excellent point, and certainly it's been talked about. We do need to do credible messaging. You know, you hit on an interesting point, and one of the issues that you're hitting on is older folks are used to getting the flu vaccine. They're used to the pneumonia vaccine. As someone who is recovering from the shingles, I can tell you we should all be used to getting the shingles vaccine. And by God, if you're eligible, get it. Trust me, please do that. But we're used to that. And so this is something that makes sense to us. And I think that we've just gone through a presidential election where there was a lot of very different messaging going on. We have a lot of odd messaging going on right now, continuing to go on with our federal government in Washington. And so we need to overcome that. And I think you're right. The best way to do that is with credible messengers who can let folks know that, you know, that this vaccine is really very important for everyone's health. And those of us that are healthy in the community, right? Folks that are healthy, the vaccine is just as important. Mm-hmm. And I learned that when I was a caregiver for my mom. I remember getting her the flu vaccine, and then they looked at me and they said, well, roll up your sleeve, you know? And I said, what are you talking about? They're like, oh no, you know, you want to protect her, you need to get the flu vaccine as well. And I think that that's some messaging that we really need to push, is that people understand when you're healthy, you have the same burden to do that, because we're all committed to helping one another, right? And that's the whole point, is as a community, we're going to get through this. So the messaging, though, is important, and those conversations are starting. I know early on when we talked about Protect Your Circle, the city was, I think, very successful in putting forward messaging. We engaged some of our artists and videographers and folks in the community to help with that. And I hope that we can do that again, because I think that will be very important. But getting the word out and having it be a credible message, Madam President, is critical.
To add to that, Madam President, I got to say that what you just highlighted is the very same thing that we saw amongst the community when we did the free flu vaccinations. What we found is that the education around these things are absolutely inaccurate and inadequate. Mm. And so we were trying to bring people the flu vaccination you would have swore we were giving them their death sentence by just trying to give them the flu vaccination. There's so much myth and there's so much lack of knowledge that is out there about these things that has caused there to be this extreme phobia to these resources that are actually there to help. And so this is where us being a part of the county's plan to distribute this vaccination, it's not just getting the shot itself, it's the steps leading up to that shot.
Right.
We're going to have to get involved and do forums. We're going to have the Black Physicians Network get in front of people to talk about this. I met with recently the Latino Leadership Latino Leadership Roundtable. And they said these very same things you're saying is that they've said there is a lack of trust because there is a lack of knowledge. And so literally they talked about, and this was a phrase that was stated during that meeting, they said, Dr. Archie, often we're given information, but no explanation. And so we need you to walk us through this of why we should trust. And we need people like you to sit down and do town halls and do forums and do interviews, people who have certain knowledge to help us to really understand the value, how this has on not only our lives, but our children's lives and our generations to come. And so that educational component is going to be more important than just the vaccination itself, because if we get the vaccination and none of our people who need it most get it, then we are no better off than if we never had it.
Right.
And so we're all going to need to do our part to increase the knowledge around these things and have factual data when we talk about them so that it makes people more comfortable in actually receiving the opportunities that benefit them.
Well, thank you, Madam President. That's our presentation. We can answer any questions that you may have, any additional questions, but we will definitely keep you all in the loop as we start to move forward. Please continue to stay safe, protect your circle, and we will make sure that we're doing everything possible to get the PPE and the testing and the resources to our residents as we move forward.
Again, I wish to thank you all for the excellent work that you're doing on this. I mean, we owe you a debt of gratitude. It's just really, really been outstanding. And talking about jumping into it and keeping it moving, and yeah, I can explain later. Just let me go and do it. We really, really appreciate it. And any way that we can be helpful, we are more than willing.
Thank you.
So with that, we would say adieu. We
All
are
right.